Hello, I am Dr. Girish Nelivigi, Urologist and Andrologist from Nelivigi Multispeciality and Urology Hospital, Bengaluru, Bengaluru. We have discussed recurrent urinary tract infections. Today, I'll be talking on another cause for urinary tract infection, which is seen in young women. That is, urinary tract infection starting after sexual intercourse. This urinary tract infection occurs commonly and exclusively in newlywed women after their first or second sexual intercourse. And the symptoms of urinary tract infection, as we already discussed, are burning sensation when they pass urine, increased frequency of urination, urgency, sometimes fever and chills, sometimes itching of the vagina, and other such similar symptoms. When a sexual intercourse takes place after marriage, there are two reasons why urinary tract infections occur. The first is purely mechanical. The very mechanical act of insertion of penis in the vagina disturbs the bacteria which are normally resident in the vagina and force some of them to get into the urethra and from there into the urinary bladder. So it's purely mechanical. Second, but less frequent cause is infections from the male to the female. If the man or the husband harbors some infection, he can pass on that infection to his partner after intercourse. Now, how to prevent these infections? One is inquire if the male partner has got infections and treat him. Second, use condoms while having sexual intercourse, especially when there is infection in the male or in the female and while they are being treated. Third thing is the woman has to pass urine after sexual intercourse so that she flushes out the bacteria from the bladder outside. Fourth is increase the water intake so that the bacteria are again flushed out because of increased urine output. However, if these measures do not work, then the doctor, especially the urologist, will probably advise long-term antibiotics or better still prophylactic or preventive antibiotic just before intercourse. This is very helpful and this prevents urinary tract infection associated with sexual intercourse. Over a period of time, after 6 months, 1 year or a few years, these infections because of sexual intercourse, they disappear. Urinary infections are sporadic in nature or sometimes could be recurrent because of other reasons. So the treatment of urinary tract infection because of sexual intercourse is antibiotics and by other measures as I already referred to. Thank you.